Evolution is an integral part of human existence, and it is funny how even in the 21st century we still have a lot of ignorance and missed civilization and those living in the urban areas, which is the city. We always easily just look at people in the village and feel they are, village people, they are uncivilized, they are uncultured. But in the end, ask yourself, what role are you playing as a city boy or someone who lives in the city? And this, of course, is particular with health as our focus. And health being that we are looking at what affects us, one of the most important things that affects us, which is sickle cell. And that's why we always advocate that to have a sickle cell free society, the first thing you need to do is to learn the genotype of whoever you are attracted to as early as possible. If you like, criticize and say we are trying to reduce the chances of AS, to find suitors. But I mean, why would you want to put yourself through a conjecture of coming across another AS and just keep calculating all the time whether you have a child with sickle cell or not, or you're going to raise enough money to go about preventing to have a child with sickle cell? Now, there are certain things that happen in our society that makes us to believe that we can actually do better. And the first is that we have different issues surrounding sickle cell as it may be. And one of the biggest issues surrounding sickle cell is an institutional bias, institutional negligence, ignorance from the part of those that are supposed to be the healthcare providers, those that are supposed to be the caregivers, and sometimes even the warriors themselves. Now, the first one, which is the institutional bias of the system itself, which is going to look at the health workers, is the fact that we have a lot of nurses, doctors graduating yearly, and we don't have new developments in the health sector. And this is affecting sickle cell because this system is operating the same syllabus that has been right from when nursing started and when medicine started. And we think it's actually a hematology thing, because even in the hematology world, we have a lot of hematologists that are not understanding sickle cell beyond science. Because yes, sickle cell is a blood or a genetic disorder that touches on blood related issues as well. But beyond that, there is a life. There are numerous triggers associated with sickle cell. You have emotional triggers, you have bacterial triggers, infections, menstruation, and all that. So sometimes it's not just about the science. The first thing the hospitals do is to say you brought a patient with sickle cell, you're trying to explain to them that this patient reacts to certain medication. This patient has issues with certain treatments, and the first thing they think is you are drug seeking, or they want to gaslight and say you're teaching them their jobs. But the first person you should listen to is the caregiver, the person that lives with this person, the person that understands what happens to this person. I mean, most of the time, without a test, a hematologist or a doctor cannot tell that this is what this person is going through. But the caregiver can suspect and say, okay, I've seen this before, it has happened before, so I'm going to recommend this. And then in your wisdom as the health provider, you use the information and get better. It's to make you look good. It's just like in the film world. Everybody comes together to put ideas for a director. The producer assembles a team, and the director has a light man, sound man, cinematographer, and production designer and everything. But in the end, the directive of action and cut comes from the director, which nobody would debate. So a doctor is just like that. You listen to the suggestions, pick the ones that work, and when the coast is clear, you give the directive, okay, let's do this. So that's one aspect of looking at it, because some of the hospitals still practice a kangaroo kind of approach to treatments, which is also making our job difficult. Kangaroo in the sense that the first thing you bring a patient, they don't know what the trigger is. The first thing they want to do is give him antibiotic, give him anti-malaria, give him pentazocine. Once you keep trying these things and they are not working, meanwhile you would have just found out what the major cause is and treated it, and then save everybody the time. By the time they discover what's actually wrong with the person, the person must have spent quite some money. I have experienced this before. They treated a patient, we paid up to 25,000 naira, we had an outstanding of up to 7,000 naira, and then we discovered that this girl is experiencing this crisis because she trekked, and it took us about 2-3 days, because we were expecting that the doctors will find out, and then we were saying that okay, this girl was well previously and she went for an event. Yeah, part of it is probably our negligence, but I mean, when you take somebody to the hospital, the first thing you should find out is the trigger. So the second aspect of the health workers is the fact that most of these hospitals are not built to handle sickle cell cases. I mean, they don't even have resident hematologists, they don't even have consulting hematologists, they just have doctors and pharmacists and all that. And then when a patient is brought in, this is a sickle cell case, you don't understand the sickle cell protocol, you're a gynecologist. I mean, some of these hospitals that are maternities and whatever, they are gynecologists first. So they will just make a general assumption, okay, sickle cell is about pain and they give analgesics and that's all. But that's not the point. If you're not equipped to treat this patient, refer the patient to a hospital. Yes, hospitals are businesses and all that, yes, but refer the patient to a hospital that handles sickle cell cases well. You go to an orthopedic hospital and they are handling a sickle cell case. You go to a radiology expert, he has a hospital and he's admitting sickle cell patients. Why? In the end, these patients end up with complications that would have been avoided. First of all, you have cases like ulcers, you have cases like osteomyelitis, you have cases like psoriasis, that in the end, you are giving this patient a treatment that does not really suit what this patient is going through at that time. So we'll go back, instead of even having progress, we're going back to a state where we are experiencing setbacks, which does not make sense. So that's it about the institutionalized bias that we're trying to look at. Then we have patients that their family members that are caregivers are not even understanding that this thing is a process. You want this patient to just get medication and get well the following day. It's a process. It doesn't work like that. Yeah, I can understand how it depletes resources and everything, but in the end, you just have to be patient. You have to be understanding. This patient would prefer to be at home. It's because of some of these things that some patients even discharge themselves in the hospital, that you now have a patient going against his own will to please either the parents, the siblings, or the medical providers. And it's not supposed to be like that. The first expert to sickle cell is the patient. There is no expert that will tell me that you are a medical doctor, or you're a parent to a sickle cell patient, or even we that are advocates that have been working with them. We are not experts on sickle cell. The first expert is the patient, because this patient understands his body. Yes, the expert for a child might be the parent who is the caregiver or the guardian or the sibling. But in the end, you have to just understand that it's beyond your emotion. It's beyond your want for that patient. You need to understand what the patient wants and then treat it, because we want the same goal, right? So caregivers, try and be more understanding with the patients and make sure that you are supportive. I have had patients that will fall sick. I will go to see them, and the first thing we do, you hug the patient and have a conversation, and before you know, the crisis is over. This thing is psychological, but you have to find the triggers first. What are the triggers that are making this person fall sick subsequently or consistently? And then the more hospital visits you are having because of the crisis, some of these crises are things that you can actually manage at home when you find out the triggers, when you understand the body. Because these patients listen to their body. You can't listen to a patient's body for himself. All of us will try to achieve the same goal of making sure that the patient is okay, but we cannot do that without the consent or the comfort of the patient. And then the third problem we experience sometimes is with the warriors. You know, your lifestyle is the first advocacy to sickle cell enlightenment and advocacy. So this means that people see what you do first. You can't be someone that, you know, you're battling sickle cell, you have one issue or the other, and then you're drinking alcohol or you're living life anyhow. It might be easy for us to say, but these are things that I have seen happen, and it doesn't help anybody when we shy away from it, because you need to first keep yourself hydrated, keep yourself warm, keep yourself avoiding triggers, keep yourself away from emotional distress. Yes, you already can be temperamental, you can be agitated, so try to avoid things that keeps you agitated, keeps you temperamental, for your own sanity, for your own mental health, and for your own healthy, crisis-free lifestyle. You know, so sometimes you are trying to raise money for a warrior who has one complication or the other, and then this person is living a kind of life that is making people question whether what you're trying to do is worth it or not. I mean, a warrior that has need for surgery should first of all give people reason why they should donate, and that reason comes from the lifestyle that is approved by people, the people that are donating for you. You can't be socializing and living anyhow, and you want people to fund it, to fund your wayward lifestyle. It doesn't make sense, you know. So, and I know no matter what we do, sometimes no matter what happens, sickle cell still happens. Like, you can do everything right, sickle cell still happens. But we're saying that try as much as possible to do what you can do that is going to help the situation for everybody to grow. And in the end, you win. Sickle cell does not win over you. That's the goal. So I believe we can work together to avoid the sickle cell free society, where you find out right from day one that the person you're attracted to is not compatible with your genotype and you move on. Not when you have spent 7-8 years in a relationship or even more, and then you're ready for marriage and you're going to do genotype test. And doing the genotype test, lab error is a thing. So try as much as possible to conduct this test in government approved labs, you know, or a very reputable lab. Make sure you have conducted this test up to 3 or 5 times in a period, you know, in between, that can give you some time lapse to say, okay, even if something had happened, even if there's an error, there is a room for correction. We've seen people that had 11 tests done I don't know, I can't tell you what went wrong, but the person eventually comes to have a child with sickle cell. So if you try your best, posterity will not judge you for error, even though you would have to put up with the challenges that comes with it. But the first thing is for you to be able to have a reason to avoid putting yourself in situations that would affect you. So let's work together to have a sickle cell free society. Help a warrior if you can. Hug some of them that you feel they need the love. Show them the love as much as you can. Donate if you have the means to, and also try as much as possible to enlighten the next person close to you. This is Sickle Cell Media and Enlightenment Center JOS, and we try as much as possible to give you information that helps us manage sickle cell better, avoid sickle cell children coming into the world, and of course to make sure that we are a better society. My name is Viapang Edward Alpha. I am a media expert with the Sickle Cell Media and Enlightenment Center JOS, and I'm always glad to bring information at your fingertips.